Well, the federal government says there is a decline in the number of new cases of Lassa fever in the country.
Dr. Chikwe Ihekwazu, the Chief Executive Officer, Nigeria Center for Disease Control, said the country had witnessed a reduction in the number of people who have died from the disease compared to 2018.
He revealed that the NCDC and partners have continued to sustain response activities in states across the country despite progress made so far. Joining me now via Skype from Abuja is public health consultant Obinna Ebirim. Thank you for joining us, Obinna.
Good morning.
Well, good morning, Obinna. Well, response to all of this is said to have been responsible for the progress made so far. But then we've been struggling with this disease for over 50 years. What changed in our approach?
Okay, so first of all, what we need to understand is that the rodent, the particular type of rat that transmits this disease to humans, is available in this part of the world, and this disease has also known to occur mostly in the dry season. So when you have the vector quite populous in your country or location, and there is also a seasonal angle to it, it's difficult to totally eradicate this disease. What is then important is that this disease, when it breaks out, it's identified earlier. There is adequate contact tracing, and there is a multi-sectorial, multi-disciplinary approach to responding to this outbreak. And I think that's what the NCDC have done well, but there's also room for more improvement, because we need to get to a point whereby we don't have to have 1,000 cases occurring during an outbreak. We need to identify these diseases early and then mount this outbreak earlier than we are doing it now. But averagely, I would say that the response has been okay, and there have been reduction in cases since the last 50 years.
Okay, there is a national Lassa fever research plan coming up, and Nigeria is to be a part of this for the development of a Lassa fever vaccine. How much impact will this make going forward?
So beyond it being a public health consultant, I'm also a vaccine advocate. And so I believe in the power of vaccines. Vaccine has really contributed to the reduction of various deadly diseases. In fact, in the days of smallpox, where it killed a lot of people, but right now no one hears about smallpox. So I believe that with adequate research and the development of a vaccine that can prevent Lassa fever, that could be would I say the result we've been waiting for, that approach that would then end Lassa for good forever. So I believe that if there are vaccines will prevent people from getting these diseases, and over time the disease will be eradicated. So I'm for research, and Nigeria should really apply itself as much as possible.
Obinna Ebirim, thank you for your time on TVC Breakfast.